So, you've just been told you have a TIRADS 4 thyroid nodule. Maybe it showed up during a routine ultrasound or as part of another scan. What does this mean? Do you have cancer? Do you need surgery? Is this urgent? And in the next few minutes, we'll walk through everything you need to know, and based on the latest medical guidelines. Let's take the mystery out of this diagnosis and help you feel more in control. Let's start with the basics. TIRADS stands for Thyroid Imaging Reporting and Data System. It's a scoring system doctors use to evaluate thyroid nodules based on how they appear on an ultrasound. When a nodule is labeled TIRADS 4, it means it shows features that raise moderate concern. Things like a taller than wide shape, tiny calcium specks inside, or irregular jagged borders. But remember, TIRADS 4 does not mean you have cancer. It simply means your doctor wants to take a closer look. In fact, most TIRADS 4 nodules turn out to be completely benign. So if you've heard this term from your doctor, take a deep breath. It's not time to panic. It's time to get clarity. You might be wondering, how did this even happen? Could the nodule have been there for years? The answer is yes. Thyroid nodules are very common, especially as we age. They often cause no symptoms and are discovered by accident. Now let's talk numbers. TIRADS 4 nodules have about a 5 to 20% chance of being cancerous. That means over 80% are not cancer. Still, that 1 in 5 risk is enough to take seriously, and it's why doctors usually recommend more testing. That next step is often a biopsy. Specifically, a fine needle aspiration, or FNA. This is a simple low-risk procedure where a thin needle is used to remove a small sample from the nodule. It takes just a few minutes, usually with ultrasound guidance. No sedation. Just a bit of local numbing and mild discomfort. Doctors usually suggest a biopsy if your TIRADS 4 nodule is 1.5 centimeters or more. If it's smaller, your doctor might just monitor it instead, especially if you have no other risk factors. And while it's not urgent, it's best to get the biopsy done within a few weeks of your scan. After the biopsy, the cells are sent to a lab. Results typically take a few days. You'll hear one of three things: benign, suspicious, or inconclusive. If the result is benign, that's great news. It means the nodule isn't cancer, and you usually don't need surgery. Just regular follow-up scans to check for changes. If the result is unclear, what doctors call indeterminate, you might need a second biopsy, molecular testing, or even surgery depending on your risk profile. And if the biopsy shows cancer, stay calm. Thyroid cancer is usually very treatable and grows slowly. Most people recover fully with surgery and monitoring. Now, not all TIRADS 4 nodules need to be removed. If it's not cancer and it's not causing symptoms, many people just monitor it over time. But if it's bothering you, say it's large, uncomfortable, or affects your swallowing, there's a non-surgical option called radiofrequency ablation, or RFA. RFA uses heat energy to shrink the nodule. It's a safe outpatient procedure that avoids surgery and recovery time, but it's only for benign nodules. Even with a benign result, follow-up is important. If your nodule is 1.5 centimeters or more, your doctor may repeat the ultrasound in about a year. If it's stable, future scans may be spaced out every few years. For nodules between 1 and 1.4 centimeters, doctors usually recommend scans at 1 year, then again at years 3 and 1.5. If your nodule is under 1 centimeter and you have no risk factors, many doctors don't recommend routine follow-up at all. Still, if the nodule grows or changes, your care plan may change too. Now let's talk about lifestyle. Can diet, supplements, or home remedies shrink a thyroid nodule? There's no scientific proof that lifestyle alone can reduce nodule size, but staying healthy, avoiding iodine extremes, and keeping your thyroid in balance is always helpful. Most countries use the TIRADS system, though specific guidelines may vary slightly. Your primary care doctor or endocrinologist will usually manage your care. If surgery is needed, you'll be referred to a thyroid surgeon. And what about cost? Most health systems and insurance plans cover biopsy and follow-up if they're medically necessary. Still, it's a smart idea to check your coverage ahead of time. So, if you've just been told you have a TIRADS 4 thyroid nodule, know this: it's not a diagnosis. It's a prompt, a reminder to look more closely. The odds are in your favor. Most nodules are harmless, and even those that aren't are usually treatable. Stay informed, ask questions, and take one step at a time. If this helped you, feel free to like, share, and subscribe for more clear and simple health explanations. Take care.